Hi, I'm Kelly Smith, and I'm a speech language pathologist, and I'm excited to share with you a little bit about what speech pathology is, where speech pathologists work, and what it takes to become a speech pathologist. So I hope that you enjoy this presentation, and I welcome you to ask any questions. If you would like to know a little bit more, please feel free to reach out to me, and I would be happy to share all about what I do and answer any of your burning questions about speech language pathology. All right, so bear with me while I share my screen and we'll get started. Okay, so here we are. So like I said, I'm going to be speaking about a career in speech language pathology. I have been a speech language pathologist for about 17 years now, and I'm going to share a little bit with you about all the different settings I've worked in and different clients, and see if I could spark a little interest in you, because I think that it has been a wonderful career for me, and I'm going to tell you a little bit about why. All right, so what is a speech language pathologist, and what does a speech language pathologist do? A speech language pathologist can work with children, adults, and families, and we're going to be working on a wide variety of communication disorders related to speech, how you actually say sounds, language, what you understand and how you express yourself, cognition, which could include your memory, how your brain is able to relay a message to your mouth or your voice, and your voice, and also swallowing deficits. So that is a wide variety of topics that a speech language pathologist can address. And once you get through school, then you get the opportunity to try to focus on one of those areas. Some people might work with children in schools, where other people might decide they want to work with children, but they want to be in more of a medical setting. So they might work in the NICU with little babies, or in a children's hospital with kids who maybe are recovering from, a trauma at birth or otherwise. So they'll stay with that child population, but in a different setting. Similarly, there are speech language pathologists that work with adults in a hospital setting or a nursing home, or possibly in an outpatient setting in, following a stroke that affects cognition and language. So let's jump ahead to the next slide. All right, so this involves, so what a speech therapist would do on a daily basis or throughout the week. The speech pathologist is responsible for diagnosing the problem or disorder. I'm going to bring myself back so I feel like I'm talking to you guys. As well, the speech therapist develops a treatment plan based on that diagnosis. The therapist will also, and I'm interchanging speech therapist with speech language pathologist. Some people will say speech pathologist. So those are all interchangeable. So I'll be using different terms throughout. The therapist will also be treating a problem or disorder using a variety of different strategies and techniques unique to the disorder or the individual. And we can talk a little bit more about that as we go on. Oops, sorry, I lost my slide presentation. Sorry about that. All right, let's skip ahead. Something that speech therapists don't do is present very often. So let's get to this one. Here we go. All right, next, they provide strategies for the patient. So sometimes that we will provide strategies for the patient to take and carry over at home, or possibly provide to the family to use as techniques to use in the home or away from the clinical setting. Oh boy, sorry about that. Resume our share, okay. And I'm just going to play this little video about speech pathology to give you a little idea. Here we go.
Speech therapy is helping kids and adults learn how to communicate their thoughts and ideas and get their point across so that others can understand them.
Speech-language pathology is versatile. You can work with kids, with adolescents, with adults, with the elderly.
I chose it probably because I had a speech impediment as a kid. I couldn't say my R's, and I know what it feels like to not want to talk, to feel embarrassed, not confident in what I could do. It's true, there's not a lot of males in this profession. A huge population of children with communication disorders are boys, and they seem to respond well to someone who went through the same things that they did, someone they can look up to, someone they can feel comfortable with.
The positive aspects of this job is that you get to see growth. You get to see the results of what you're doing benefiting someone else.
I think in the health professions, a lot of times you kind of have to get in and out and move on to the next patient or client. And with speech therapy, you really get to take the time to get to know who you're working with. You see them on a regular basis, and you get to create that bond.
The drawbacks with working with people is they might not recover like you would hope. And you put your heart into helping them regain their ability to communicate or to swallow. And sometimes they can't or they don't.
You do have to deal with the paperwork, filling out forms for kids who are in speech and keeping up with their progress notes and all of that. And the other negative aspect that I've found is that sometimes there are difficult parents that you have to deal with a bit.
I have found that being a speech-language pathologist, you have to be a really good listener. You would think by the name of my profession that I'm talking all the time. I'm not. I'm trying to get others to.
You have to be able to get along well with a vast group of people from different backgrounds, different cultures, different disorders.
I think it would be important advice if you're thinking about speech-language pathology to go shadow a speech therapist.
I would also recommend making sure that your grades are good for undergrad, because to get into a graduate program has gotten to be fairly competitive. But the good news is that once you graduate, you have job opportunities all the time. I get job offers once a week, twice a week.
I probably get 3 to 4 phone calls a day asking me if I'm free to work.
I got a job offer yesterday for Florida. Last week I got a job offer in Tennessee. The week before I got 2 in Michigan. 2 weeks before that I got 3 job offers. Like literally every week I get called. There was 1 week in there that I didn't get a call.
There's not enough of us to do the work that needs to be done.
My favorite thing about this profession is impacting lives. And communication is so human. It's so important. When you have a child come into you and it can only speak in H's and vowels, and have them a year or 2 later walk out of your office being able to speak like, their other friends in kindergarten, that is a great feeling.
There we go. I really love that that little video, because it just touches on everything. It touches on, the reasons why most people choose to be speech language pathologists. It touches on the versatility of settings and clients. And it just talks about, the impact that speech language pathologists have on their patients and clients. So I really love that video. And I agree that there's not enough of us. So if you're looking for a challenging yet rewarding profession, this is definitely it. And when you are done with all of the schoolwork and you get into grad school and you complete all of that curriculum, you come out with opportunity, lots and lots of opportunity, and that's a bonus. Alrighty. So let's see, we're gonna get out of here and move on to the next slide. There we go. All right, so types of disorders most commonly treated by speech language pathologists. So here's when we get to the bulk of who we're going to be working with. All right, so I'm going to throw a lot of information at you, and I'll kind of, go through it a little bit quicker than I might in person, but, you'll have an opportunity to review the slides and go over each area. But the first thing is speech-related disorder. So when you think of a speech-language pathologist, a lot of people will think of a speech therapist. And what is speech? So speech is articulation, phonology, fluency or dysfluency, and apraxia. So what does that mean? Articulation is how we actually say our sounds. So when you think of, maybe students that go to speech therapy in school, in elementary school, maybe they'll pronounce their S as a TH. So maybe they'll say sock instead of sock. And those students go to the speech therapist to work. Well, they're working on their articulation. They're working on how to say sounds correctly. Then there's phonology, and phonology is more a language-based sound disorder. So, maybe a child may not hear the difference between, the word, for example, at the end of a sound, maybe instead of writing the word sock, maybe they're writing the word sut. And just understanding that each sound has its own corresponding letter, and learning a little bit about that. So it does correlate to reading somewhat. Then next is fluency. Dysfluency means not fluent speech or stuttering, as we most likely have heard it called. And that's just a disruption in your speech sound flow. So I think we're all pretty familiar with stuttering, but that would, look at when children are super young, they may repeat parts of words. So maybe they say, I go to the store. Another child with fluency issues or an adult with fluency issues, they might say, I need to go to the store, and get stuck on a certain sound. So we work on ways to address fluency. And then there is also apraxia of speech, which is a motor-based sequencing and planning disorder. And that is an interesting disorder because that has a huge connection to your brain. So you're having difficulty planning how you move your mouth to say words and sounds, sound combinations. So for example, a child may, or an adult, again, a lot of the adults that we see are being seen post-stroke. So something happens, a misfiring happens in the brain, and it affects their speech. So that may look like, somebody might say one time, I want to go get candy, but every time they say it, it comes out a little bit differently. I want to go, I get candy, or, I go and get candy. And they can't get the same exact motor pattern each time. So it is a sequencing and planning issue. So those are some of the speech-related disorders. And then we'll move on to the language disorders. So the language disorders are relate to three different domains. There's receptive, expressive, and pragmatic. So what is the difference between all of them? Receptive language refers to how a person understands what's being said to them. So if we give somebody a direction, go across the street and grab some milk from our neighbor. That is, they need to listen to the direction, understand it, and then follow it. The opposite of that would be expressive language. So if, maybe a child in a school is working on their expressive language or their vocabulary, it refers to the person having difficulty getting their basic needs and wants met. So, maybe they need to just ask to go to the bathroom, but they cannot put that in a sentence. So they might just keep saying bathroom, bathroom, or go, instead of saying, may I go to the bathroom? So that is your expressive language. And then finally, there's pragmatic language, and that's a person, somebody who has pragmatic language disorder means that they're having difficulty understanding and using language in the social domain. So, we often say that person has trouble, they're a little quirky, or, they're having trouble getting along with others. They seem to miss social cues. So all of those things are pragmatics. The way that we raise our voice when we're excited, or if we ask a question, and at the end we raise the intonation. So maybe we'll say, do you want to go to the store? Or you want to go to the store? Or, oh, you want to go to the store? Those differences in intonation, those are all super subtle social cues that we give to each other when we're speaking and we're having a conversation. And there are many, many people who have trouble picking up on those cues or relaying those cues to others. So that is pragmatic language, the social use of language. And again, pragmatics, that's an area that could be affecting a young child. Often we see it with children who have autism or have other cognitive delays, but it also can be something that impacts this person who is post-stroke. That part of the brain may have been damaged, and they need to relearn how to be socially appropriate. So those are areas that, as far as language, that a speech language pathologist would work. Hearing impairment and oral rehab is an area that I like to touch on as a place where speech language pathologists work, and they play a role, because this is actually how I became introduced to speech language pathology. My brother is, he is 8 years younger than me, and he was born, and then a few months after he was born, he had pertussis, and he actually acquired a severe hearing loss. At this point, he has 2 cochlear implants, and he is verbal, but it took a lot of work for him to get there. So the speech language pathologist worked closely with the audiologist, the person who specializes in hearing and hearing loss. And he worked with a speech language pathologist throughout, his, I would say, probably from the time he was diagnosed until he was in freshman year of college. And, they play a role in identifying children who have a hearing loss and identifying where the delays in language are. They also assess sound production, because often when a child cannot hear himself saying something, there are errors in sound production. So we work on speech, language, and also pragmatics, because some of the social pieces of communication and language are missed when you're not able to hear all of the surroundings. So a speech language pathologist is also a key participant in a team for somebody who has a hearing impairment, whether they are children or adults. Okay, cognitive related disorders. So this is where a speech language pathologist would support somebody who is having a disorder related to learning, memory, perception, and problem solving. So often, like I said, speech language pathologists work with people who have had strokes, and post-stroke. Sometimes the part of the brain that is in charge of problem solving or planning your day is impaired, and they need to relearn those skills. So a speech language pathologist would come in and often work with other professionals as well, occupational therapists and physical therapists, and we'll touch on this a little bit later as well. But they all work together as a team to restore a person's functioning back to pre-stroke. Also, a child can also work on these areas as well. Sometimes we just all have our differences, and some areas we are better at than others. And if a child is having difficulty with planning and organizing daily events, then a child can also work with a speech language pathologist on sequencing steps of the day, and problem solving as well, and learning and memory. All right, now voice disorders, which is super interesting. It is not an area that I've worked on personally very much. I was able to learn and experience a little bit about voice disorders when I was in grad school, because grad school is an amazing opportunity to touch on all of these different areas, get some experience, and then determine what excites you and what area you want to focus on. post-graduation. But speech language pathologists are experts in how the vocal tract works. So they look at medical conditions that affect your pitch, your loudness, quality of voice, and thereby affecting your speech production. So if you can think of somebody who maybe has overused their voice, I feel like right now I'm overusing my voice because I'm talking so much, but if somebody overuses their voice and they become quite raspy, you have to think about, what do we need to do to take care of our voice and our vocal folds? We need to stay hydrated. We need to rest our voice. So if you think about singers, speakers, people who have had just different conditions, maybe they, damage their vocal folds because of smoking or inhalation of something, I don't know what, but you get the idea. If there's any damage to the vocal folds, you're going to have a voice concern, and you can see a speech language therapist who focuses and can teach you about, taking care of your voice. All right. I'm going to pause for 1 second. Excuse me. Speaking of all the voice issues, I need to take a drink. Okay. So, excuse me. The next thing up, it is ironic, isn't it? That it's dysphagia and swallowing. Excuse me. So, dysphagia is a medical disorder related to the oral phase of a person's swallow, which can place a person at risk for aspiration or weight loss. Alrighty, hang on 1 sec. All right, so dysphagia can occur at any age and often requires a diet, texture, or liquid change, or even an alternate means of nutrition or a feeding tube. So if you think of somebody who, again, is post-stroke, they may have some damage to their swallow. Or as people get older, often there's an issue with swallowing. Your muscles just become a little bit weaker. And the problem with that is that when a person is swallowing and the swallow is not strong enough, that the food or the liquid can slip into the wrong tube. So when you hear, went down the wrong pipe, it slips down the wrong pipe, and it goes into your lungs. So number one, you're not going to get the nutrition you need. So there's weight loss there because the food or the liquids are not going into your digestive system like they're supposed to. And they're also at risk for aspiration, which is letting that liquid or that food go into the lungs, and it could become pneumonia. So that is a huge issue. And this is a huge area for speech language pathologists, which is very interesting and, very different from the route that I went, where I went into the schools working with children. This is more of the medical side. It is very awesome. It is very rewarding. And, you get to watch somebody, possibly go from needing to be on a liquid, sometimes like needing to be on a thicker diet. For example, maybe if they are drinking water, it's, going so fast down their vocal, or down their swallow, their oral phase, it's going so quickly that it goes right into the lungs. So maybe they need to add a little bit of a thickening into that liquid so that it goes a little bit slower and they're able to control the swallow a little bit more. So a speech language pathologist would be the person that would assess the swallow to see if the liquid or the food is going in the direction that it should be going. And they do use a stethoscope to do that. They would be listening, and they determine if there is a swallow disorder. And if there is, they would change the diet so that the person is no longer at risk for aspiration or weight loss, and then work on strengthening and teaching compensations for that person so that they can hopefully get back to a typical diet. So that is the medical side of things. Let's see, we have here, sorry, okay. Another area, and I believe this is the last area, yep, AAC. There are there are many other areas that speech language pathologists support teams, both medically and in schools, but these are the big pieces. And this is the last big one that I wanted to touch on for this presentation. It's alternative augmentative communication, AAC. So if you've ever seen somebody who is communicating with a device, or if somebody is communicating with pictures, that is AAC. So it is an alternative means of communicating. So AAC devices are used, like I said, in either high or low tech format. So a high tech device would be like a big computer screen where the person using it may be typing things to you and then the computer talks for them. Or there are people that actually even use their eye gaze and they look at the letters and spell things out, and that then the device will communicate to the listening partner. And like I said, there's also low tech format. For example, if a person has a hearing impairment, they would need to have an alternative communication possibly to communicate with the phone. Maybe they don't do well taking a phone call because their hearing device is not effective enough to get a clear message. So maybe then they just text their communication partner. That would be considered an alternative communication. Also, if a child is in a classroom and they are not verbal, they are not speaking, they might be able to hand a picture card to their teacher to say, I want to use the glue. And maybe it's a picture of glue and they hand that over. That would also be a type of alternative communication. And the role of the speech therapist is to, one, identify the needs in the child or the adult's environment. What is their core vocabulary? What is the information that they need to share or need to be able to participate in a conversation, and figuring out what format is going to work best for that person to communicate with their environment. And then they help them utilize that format and express themselves as much as possible. So communication is the key part in this type or this area of speech language pathology. How are we going to get people who otherwise would not be able to communicate verbally to communicate with their environment? All right, so I threw a lot at you as far as, where a speech language pathologist might work. And now you need to know, how are we going to get there? And, as I said, it's a highly competitive field as far as getting your education or getting into programs. But once you do, it's so worth it. So let me tell you a little bit about what the education requirements are. You will finish high school, and then you will go on to an undergrad program. That would be a four-year college. And then from there, you're going to need to get your master's degree. I actually attended undergrad at Loyola College in Maryland, and it's now Loyola University in Maryland. But I attended Loyola, and I was very lucky because I had already known about speech language pathology, which is a kind of like a niche area, but I knew about it, and I was interested, and I really was considering pursuing that career. And since Loyola had it, I did my undergrad in speech language pathology. That was a huge, advantage for me, because then when I went on to my master's degree, I had so many of my classes and my courses already done. And then I actually ended up staying at Loyola for their 2-year master's program. So I would say if this is an area that you are interested in, research the schools that have an undergrad program. It's just going to put you a little bit ahead, and then you'll have some nice connections with teachers who are in the area of speech language pathology, and that could be a perk as far as getting into some master's programs. So you will do your undergrad for 4 years. If you can find a program that's undergrad in speech language pathology, that's amazing. Mine was actually speech language pathology / audiology. So I could have gone either route for my master's. And then you will need to take a GRE, which is your graduate record exam, and pass that exam in order to get into a master's program. So, and then once you're in the master's program, it's a difficult program. There's science, there's writing, there is, lesson planning, but you're able to get experience in all of the settings that I had mentioned, and then move on and actually use your skills and practice, do a practicum. So once you graduate then for your master's program, you'll move on and you will have to do a CFY, a clinical fellowship year. And it's actually a 9-month year. You will be working and, as independent as possible with some supervision. Once you finish that CFY year, then you will take a test to receive your certificate of clinical competency. You pass your boards and you're considered a full speech language pathology with your C's, your certificate of clinical competency. So it's very exciting. It is a lot of work, but it is extremely rewarding and a very supportive group of people that you are entering into the workplace with. Alrighty, so let's see here. So we've already talked about this, some of the different therapy settings. You can work in hospitals, schools, home therapy, nursing homes, outpatient clinics. There's just so many different places you can work, and specialty clinics like voice or fluency clinics. So there are plenty of places you can work, and you can also work as a private practice clinician. Once you have your license in the state that you're working in and you have your C's, you are able to have your own private practice as well. So I kind of went over this a little bit, what inspired me. I told you a little bit about how my brother has a profound hearing loss, and I watched the impact that his speech language pathologist had on him. It's extremely gratifying profession. You know that you're helping to improve somebody's ability to communicate or swallow safely. Some things that I feel like you have to keep in mind are to the paperwork. So in any medical profession, you do need to be able to create your own schedule, handle a caseload, which means completing required documentation on time, and just being able to communicate both verbally and in writing. So, and also, you are working with families. I'm going to pause this real quick. Here we go. You are working with families. So, I feel like there is a big emotional piece to this. It's very personal, which to me makes it an even, more special profession to get into. But it is something that, you do want to have the ability to connect with people. It's very important. So I think this will be the last part. I just want to leave you with this little video here, just about speech language pathology. And I am going to, let's see here, the role of a speech language pathologist. All right, I'm going to start this and then I'll be back.
Speech language pathology is this wonderful blend of science and art, and it truly is this combination of being able to be creative while using your scientific knowledge. So I like to say we work from cradle to the end of life, and we work from the diaphragm to the top of the head. We're responsible for all of it, and that's very powerful.
It is such a diverse field, and we have so many options and so many different scopes of practice that we can find our niche in, that I feel that when you go into this field, the possibilities are endless.
I just feel like there's so much variety, and it pays well, and there's also the flexibility. To me, it's kind of a win on every level. I feel like I've hit the jackpot with speech pathology.
The day I received my master's degree, leading me down the path to become a certificated, licensed, and credentialed speech language pathologist, was the day that opened the door to an amazing career with amazing opportunities.
The power to communicate is the most powerful gift you can give. How can you say no to that?
Okay, I'm back. That's your last bit of inspiration. So I just wanted to, I talked about this already, you know, you want to make sure that you're really honing in on your communication skills, both verbal and written, from this point to when you have to actually apply for any graduate programs or undergrad programs. You know, pay attention to your writing and how you're, you know, organizing and planning, and just practice that. Take this time now to practice your ability to, your executive functioning, if you will. So your ability to organize, plan, and manage your time, because that's going to help you later. And, you know, if you do all of those things, the outlook for, you know, your career and your ability to find positions in the field and make a really nice income for yourself with a whole lot of flexibility depending on where you work. This is a great area for you to, you know, delve into. There's lots of opportunities to work both salaried and per diem or hourly. And like I said, if you're interested, you want to make sure you're getting out there, volunteer at schools and hospitals, ask to shadow a speech language pathologist. Many speech language pathologists would be happy to have you, you know, follow them around for a day and just get an idea of what day-to-day looks like. And, you know, you could also talk to your guidance counselor about the career. All right, so I know we're not face-to-face right now, but if this is something that interests you and you have more questions, I'm sure you can reach out to the person that shared this video with you and get my information. And like I said, I would be happy to answer any questions. I love my job. I love my career and the flexibility and, you know, the income that it's provided for me and my family. And I would be happy to share it with you. So I hope that you are enjoying your career exploration, and I look forward to hearing from some of you soon. Take care.